So in this session, I will point out those kind of things, why precision medicine matters and how can we learn the precision medicine. And finally, where are you going beyond precision medicine? So I briefly touched the Asan Medical Center. Our center is high volume medical center. So we see lots of patients, especially we see more than 20,000 international patients per year. Scale is important because precision medicine needs depth and volumes. So we are very honored we have global recognition. So according to the Newsweek rankings, some department was ranked within 10, but we think the recognition is not our goal. We want to build a system to deliver consistent clinical outcome to our patient. I'd like to briefly touch the collaboration with the UAE. So as you can see here, we are planning to open Asan GI Hospital, UAE, at the Dubai Healthcare City. It is scheduled to open October this year. This is not just the global expansion, but to share the future healthcare system together with UAE. The precision medicine, as you can, everybody know well, it is the personalized strategies combining the clinical, the genetic, and lifestyle that together. So in the year of the traditional medicine, it was kind of empirical. We gave one standard treatment to all the patients. In contrast, in the year of precision medicine, based on the scientific and personalized approach, we provide right diagnosis, right the therapy for the right patient. So next generation sequencing is clinical foundation of precision oncology. So we will start with sampling, processing, and library prep, followed by sequencing, and bioinformatics part is very crucial. So finally, we will integrate all these kind of data. The key part is clinical integration. It is turning the genomics into the medical decisions. We have realized that the NGS is not just sequencing, but clinical workflows. To enable the genomics actionable, molecular tumor board is one of the critical part. So in these virtual meetings, we invite the expert from the multidisciplinary expert. So we will review all the clinical and molecular profiling data together. We provide best treatment option or clinical trial to our patient. So as you can see on the left side, this is the step where the precision medicine becomes real to our patient. We established Asan Center for Cancer Genome Discovery 2011, and then we opened Center for Personalized Cancer Medicine. So this is not just project, but genomics embedded in patient care pathway. So we have realized that, we have learned that precision medicine requires this kind of, not only the technology, but also organization and process. And we scale up the NGS in real clinical practice. This slide shows the number of that was conducted at our medical centers. We have our own NGS panel oncopanel that covers more than 300 genes. Fortunately, this NGOS was reimbursed the Korean health insurance. So this kind of volume allowed us to build clinical experience and the reliable knowledge base. One of the essential components of the precision medicine is multidisciplinary clinic. So as you can see in the left side, this is the picture of our clinics. In this clinic, we invite the specialists of the different medical fields to provide the one-stop service to our patient. So we have noticed that this kind of the multidisciplinary clinic provide faster diagnosis and improved outcomes, and is kind of the patient-centric the care planning. Precision medicine at scale require some sort of operating system like this. That's why we developed precision medicine systems. So we integrated clinical, genomic, specimen, and clinical trial data together. In this system, it helps us to create cohort and helps us to integrate analysis. On the left side, you can see that it also provides integrating information for individuals. This system turns data into care pathways. Let's go into the details of this system. So we can generate cohort based on the morphology and primary site or the mutation status. On the left side, so you can see the dashboard mode. We can integrate clinical and genomic data together. So this kind of the precision medicine system allows us the faster research translation and better clinical decision support. This system is kind of operation backbones of precision care. So it connects full clinical workflow, registry, operation, the treatment, and all the procedural data. In addition to cancer, we can apply this kind of system to other disease types. One of the critical part for precision medicine is drug access. So that's why we are collaborating with the global the alliance of the drug companies. So Amgen, the partner of the Choice Network, the Genentech immunological program. So we are very fortunate to be designated one of the core center of this program. So this global alliance support faster the trial activation and better treatment access to innovative cancer chemotherapies. In addition to this kind of global alliance, we are also collaborating the international academic medical center in developed or the developing countries. So you can see the partners of the Middle East. So this kind of collaboration gives us very good opportunity for the joint innovation and shared standard and shaping the future healthcare models together. We hoped to learn something from the real-world practice. That's why we published outcome book every year. In this outcome book, we include the treatment patterns and clinical outcomes, as you can see on the left side. So this kind of outcome book became an institutional memory that helps us clinicians and readers to improve care qualities. Precision medicine should go beyond survival. We should measure what patients feel and what patients report. So this kind of patient-reported outcomes, so is the report without any intervention or interpretation of the clinician. We have noticed that accumulated PRO data can be used to develop symptom tracking or treatment outcome prediction. This kind of PRO system gives us to complete the precision loop. Various departments use different type of PROM tool. So on the left, on the right, you can see the list of PROM tool. On the left side, you can see the publication of our department investigators. These kind of PRO should provide support, timely intervention, reduce the complication, and the improved quality of cares in our patient. So lastly, I'd like to touch where we are going beyond precision medicine. We are moving beyond targeted panel sequencing. So as you know, whole genome sequencing covers more comprehensive genes. This kind of whole genome the analysis provide us to give more complete decision support to our patient. Another frontier is the digital pathology. So on the upper panel, you can see the analog scale. On the lower panel, you can see the digital pathology scheme. So this kind of digital pathology replace traditional microscopic observation to the high resolution digital images. This kind of digital pathology improves accessibility and standardization, and it also gives us readiness for AI application in the futures. We implemented this kind of digital pathology in 2022. So currently, we are conducting ongoing digitalization of 4 million historic specimen slides. Our center was designated as the reference center from Philips. We have noticed that this kind of digital pathology helps us the scale of consistency and the qualities. This kind of the digital pathology enables AI applications. One of the examples is Ki67 index. This index indicates how rapidly tumor cells divide. It is a big burden for our pathologists to calculate accurately in the specimen. By adopting AI, the system in our digital pathology, it definitely reduces variability, improves the reproducibility in pathologic reporting. In addition to that, the burden of the pathologist also reduced by applying these kind of systems. Last part is AI integration. So we have some discussion in the previous sessions. So I think AI should support precision medicine across all pipelines, data integration and pattern prediction, multi-omics analysis, and real-time adjustment, something like that. So it is very challenging situation for all the institutions. We have to collaborate to move forward. Let me conclude like this. So for precision medicine, it is essential to integrate the clinical, imaging, and pathologic data together. So we need requires organizations and process to integrate all these kind of the data. Cancer precision medicine is built through this kind of integration and should be validated through global collaboration. Thank you for your attention.